My name is Dr. Annika Eidson. I today have a couple procedures. The first one is we're doing a mass removal of a dog with a mast cell tumor and a dental. So this is Buddy. Hi, Buddy. We're also going to give him an injection of Benadryl. Mast cell tumors have histamine in them, so as you mess with it, you're going to release that histamine, and we don't want him to have any sort of anaphylaxis. So we give him that before we go into surgery, and we do it a good bit before so his body has time to get it in his system. This is the little mass. Mom just felt it when she was petting him, so that's what we're taking off. So here we're just scrubbing in, and we'll sterilely put on our gown, get someone to tie it for us, and sterilely put on some gloves while they finish vacuuming the patient after they've shaved and scrubbing. And I'll drape in the patient and clamp the towels down, and I'll measure around the mask to see what margins I want to take to make sure we get clean margins, and remove it, kind of take some scissors underneath it to completely get it done. And here we're closing up the first layer of the incision, and then we'll come over once I completely do that, and Dr. Madison checks in. We're going to close the skin and make sure that everything is closed up, and then after we finish that, we'll take off the towels and he'll recover. When you are doing something like a mass removal, a lot of times if your dog needs its teeth cleaned, it's best to put them together. It actually saves a little bit of money rather than removing the mask now and doing the dental in a few months. But if you did need to wait a few months and you waited until our annual or a senior, you do get $100 off after an annual or a senior. So you have 30 days to do it then. So kind of works nice if you're doing it with another procedure and the dog does well under anesthesia. That's why we take the mask off first, take off the cancerous product. And then if we do well, we can continue, and he did great. So she's just cleaning, and then we'll make sure he's good, and he'll wake up and he'll go home. I should have said earlier that a mast cell tumor is the most common type of skin cancer we see in dogs. So we see it all the time, but it is the most common. And if you remove them, as long as it's a low grade and you get clean margins, it's typically considered curative. High grade is when you have to talk about chemo. So that's why we always want to send these masses off, make sure we got all of it, and then also see what grade they are and if they're low grade or high grade, so we know what to do from there. Even if you get clean margins and it was a low grade, it's likely it'll show up somewhere else. Doesn't mean it was affected by the tumor itself, it's just the way mast cell tumors are. Some breeds are more prone to them. Boxers are like the poster child, or any like white, like Pitty or a white dog, white boxers. They seem to like to get these a lot too.